So I'm starting the webinar. People will start coming in. So we'll give them maybe a minute or two to come in because we're starting a little bit late, and then we'll do it in just a second. All right. Good morning, everyone. Thank you for joining us today. Again, we have Dr. Mira Tesfaji, who's talking about information management. Remember, as always, if you have questions, use the Q&A box in the lower right part of your screen. If you have a technical problem, you can communicate that to us in the chat box in the lower left part of the screen. We are recording the the session, and it will be available within 24 hours on the landing page where you register for the site. All the recordings are there. We will be using polling during the session, so when the polls come up, please make sure you answer those questions so that Dr. Tesfaji can respond. With that, I will turn it over to Dr. Tesfaji.
All right, thanks, Dan, for the introduction, and welcome everyone. Thanks for joining us today again. So today we'll be talking about information management. So here's our objective. Hopefully that, by the end of this lecture, you'll be able to describe important elements of an information management system and be able to explain things to consider when developing a manual paper-based information system, and describe the advantage and disadvantage or the challenges of a computerized information management system. But before I go into the details of the lecture, I'd like to ask you guys what type of information management system does your laboratory use, if any? So I have something popped up here.
All right, so the poll is live. Panelists can't vote, but we'll leave these open for about 45 seconds to a minute, and then I will share the results.
Okay. All right. So basically 10% paper-based information management system, 24% computer-based lab information system, and a combination of both 6 to 7%. Great, thank you. I can't move forward. Okay. All right, so as part of this series that we're doing in terms, the quality management system, the information management system is also an integral part of the total quality management system that we do as a lab. So for a lab to have an effective quality management system, the information management is also part and parcel of the components of the total management system. And it is important that information management system is properly structured in order to have a very successful quality in the lab. So I'm sure we all agree that at the end of the day, every activity we do, every step we go, and every transactions we do in a lab is to produce product, and that product we all know is the result. And we work hard to make sure not only produce results, but also make sure that the results that we produce has some quality. And the role of the information management system, or an intact, viable, and effective information management system, is basically to be able to manage the patient information that you're generating. As you know, lab is an information factory. We generate information and we need to take control of that information. And that the information system is all about taking control of the information that we generate in a way that it is accessible to those who need it. And mainly our customers, basically, the providers or the physicians, and to make sure that is accurate and it's presented in an accurate way, in a very timely way, and in a way that is secure and confidential and private. And therefore, these are the goals of information management system, and we need to remember that. So there are many elements of information management system, and one of those, some of those are listed here. And if you start with the first thing that we need to do as a lab is that we should be able to identify patients, and the samples that we get from our patients are uniquely identified. And the request forms that we provide to our providers in order to gather the information that we need to process patient specimens need to be standardized. The log sheets and worksheets that we use to document our information or patient information, and there should be a check-in process. There should be data protection and confidentiality protection procedures in place, and effective communication between and among the stakeholders, and effective reporting systems. So we'll see these one by one, and we'll discuss as we go. So the first thing that we need to do when, in our business is basically to make sure that we're getting the specimen that we're getting is coming from the right patient. And there are ways to identify those patients. The response are one way to identify patients. And once you get those information, the specimen from the patient, you want also to assign a unique sample identifiers so that you'll be able to trace and track those specimen uniquely. And there are a couple of ways to do that. And one way is to include, in this example provided, is to include the birthday of month, year, and date of the patient, and then you include other serial numbers basically. And in this case 4 digits, you could make it 6 digits or 2 digits or 3 digits based on your volume essentially, or more than that, and for how long you want to remain unique. That would also determine the serial numbers that you add after that. The request form is probably one of the very important forms that we have as your lab. And it is so because, the information that you need to interpret the result, to report the result, is going to be included in that form. And therefore, you need to be designed in a way that it provides you the information you need, all the way from, patient identity and specimen identity to the type of specimen that you're receiving and whether it is urgent or not, because you have to prioritize or you can wait, and other information and what tests are actually included there. So the most important, every lab, each one of us has actually this form. I guess the question is to make it as legible as possible, as clear as possible, as decluttered as possible, and making sure that it includes all the information. At the same time, it is concise and it's clean. So whether it's paper-based or computer-based information system, we need to make sure that we have a mechanism in place to minimize transcription problems or transcription errors. And in a computer-based, it's probably, it's easier because there are ways to actually, automate those checks. But if it is a paper-based lab, then it is a challenge. And one way to do that is based on your volume, is that, to have a second person check and or review the results or the entry, the data that you're entering. And again, this really depends on the volume, of the test that you do, and whether you can actually manage to have, a second person review your results. But at least the results need to be reviewed if you are doing some manual data entry. Maybe a challenge for the registration, for example, or the logs sheets that when you put like patient information, but the results need to be reviewed by a second person if there is a manual entry involved. So data protection obviously is, we've said that we are a factory that produce a lot of data, a lot of information, and we should be able to protect it. And if you had a paper-based lab, then you try to make sure that you have a durable material for documenting the patient information. I'm not really the expert what is a durable material, but I'm sure there are ways to find that. And you should be able to store them properly. And in a computer system, it's much easier, but as a lab, we need to make sure that they are backed up on a regular basis or automatically. So when it comes to protecting confidentiality and security, again, it is much easier if you have a lot, if you have Elias, but if you have paper-based, then it may be a bit difficult. But it is ultimately, it's the responsibility of the director to make sure that there are established policies and procedures to safeguard the patient's privacy and assure that lab data is kept confidential. So there are ways to, you could have a box with a locker or a room which is locked. Only authorized, persons would access it. As we've briefly touched in the previous slide, that at the end of the day, the function of a lab is to produce results, and the way you deliver it is very important, and it's really is the image of the lab. And I'm a strong proponent that in time should be a lot of thought should be given to format the reporting outline and layout, basically to make sure that it is understandable and it's interpretable and it's legible and it's accurate, and also it is delivered in a timely manner. This is an example that I got from the lab test online. You can see, you can ignore the numbers here. It's just, defines why things are put there. And you should be able, if you're interested, you should be able to access it. But, and also I should mention that the names are fictitious names, so they're not real. But if you see some important information are included here, for example, some information related to the reference range and the integrity of the specimen are included here. So you have, it's important to include information that is helpful to interpret the results. And obviously, the format may differ, and I know it differs from place to place and from lab to lab, but the effort should be the same. The effort should be to make it consistent, to make it interpretable, to make it legible, to make it accurate. And this is another example of a way of reporting for hematology, basically. And, like, for example, comments included here in the report that, there was a critical result that was relayed to a certain physician by a certain lab professional. Those informations are important in the, to make the report self-explanatory and it's readable. And this is when you have a cumulative report, and simply this is another example, and should be able to, physicians should be able to interpret the results, and as a lab, we should be able to provide them information that is needed for them to understand the interpretation of the result and what it means. And in a computer-based report, it's easy to highlight the criticals, the highs and the lows. But it may be a challenge in a paper-based because otherwise it is always a good idea to also make sure that those highs and lows or the abnormal results are stands out, basically. Communication is obviously key. In any quality management system, communication is key. And it's the same here. The information management, it does involve a lot of stakeholders, a lot of people that are interested in how the product that we produce are reported and how they are retained and how they are kept in terms of security, in terms of confidentiality, in terms of privacy. So there should be a clear policy established that outline how the communication should be between all these and among all these stakeholders within the laboratory, within clients, other healthcare providers, reference laboratories, and within official agencies, and including within the lab between different shifts. So what are the common problems that we face and that we need to recognize when we deal with, managing the information that we generate? When it comes to, receiving the requisition forms, probably one of the common ones that we get, problems that we face are data, incomplete data or incomplete information. So it's even more common if the lab is a paper-based lab. And essential informations, very, very critical information that are needed to interpret the results would be missing in certain instances, and those are a challenge. And insufficient ID are some challenge, forms that are inadequate or not well designed, and archiving poorly, defeating the purpose of the documentation or the management information to begin with. The whole process of documenting or managing the information that you're having is because there is an intention that you may use in the future. And therefore, archiving poorly or storing the information poorly defeats the purpose. Other information like data are not organized very well, or when you document the information, they're not documented in a way or in feature reports and generating essential indicators were not in mind, basically. And mainly in a computer-based lab, transmission errors and computer system incompatibility are some of the problems that a lab would face. So if we go to some detail into the manual-based system, so if you're planning to design, registers and logs to document your information that you generate, I feel like there are 3 pillars or 4 pillars that we need to think about. And first of all, is the purpose. The purpose really is we document it because we're going to need it in the future, and we need to keep that in mind. And therefore, the first thing that you need to remember is to determine the documentation material. You want to make sure that it's durable. And design the documentation process. How do you want to design, and what are the information that you want to capture that are needed currently and also in the future? Like, for example, to make a retrospective analysis to capture some information, like if you want to capture a turnaround time, for example, or do you want to capture how many specimen integrity, for example, how many of these specimens were clotted or hemolyzed, or not properly filled, for example. So with that, when you design the registers, you will need to think about what are the data that beyond the identity of the patient and the results, what other information do you want to capture? Those are the things that you need. And you want to design in a way that's very easy to find the data. So very easy to basically summarize and write reports. And standardized documentation process is also one thing that we need to keep in mind, because given that within the lab, between sections, the design might not be exactly the same, but the intention and the purpose need to remain the same, so that it's standardized. And one important thing, last thing but important is, what do you do when you archive this? What are the things that you need to do? And how do you secure those information are the things that you need to think when you design this. So these are some of the examples that you would face in a data entry. In this particular case, for example, there is a question of some of this information are not completed, and there is a legibility question probably. There are some things that I can read here, but again, this is the challenge of paper-based documentation, and a misplaced the result, for example, is placed in a village column. I can't see it, and I'm sure you can't see it. But the whole point is that the challenge is really, how do you enforce, or how do you make sure that the staff actually follow the columns that are provided here? How do you enforce it? And that's really the challenge. One way to do is that to continuous supervision, checking, making sure that things are being done the right way, and be able to also find a way to make sure that you include who actually entered the data here, so that whenever you identify problems, you can make a targeted education or a targeted counseling to the person. Efforts like that could improve. This is another example that where the writing is not legible. And again, it is a challenge. And how do you make sure that the writing is legible consistently? And we know that our writing differs. And probably one way to do it, and this is me thinking out loud, is to write it, uppercase, for example. Maybe that would help. But to continuously remind staff and personals that the reason and the purpose why we are documenting this, to be able to use it, and therefore it should be legible if you're going to use it. So we've touched it in a general the result report, but specifically when we talk about paper-based report, and if it is handwritten, then it's a challenge. But again, it is the image of the lab. It is what you are producing at the end of the day, and it need to be significant effort need to be given to make sure that it looks professional and it includes all the information that is needed. And also you need to, and we need to find a way to make sure that we have copies. And one way is to just, register the results on a bond book, for example, or other means of copying and archiving. So we've touched this again, but the storage it is important to remember this, the goal. Why are you storing it? And what is the purpose of storing it? And understanding that purpose helps you not to defeat the purpose in the process. And the goals are simple. You want to find the results whenever you need them. You want to be able to trace the samples whenever you need them. You want to evaluate occurrences whenever you want. And therefore, you need to put those in mind to ensure that you keep everything for a designated time, ensure easy access, use a logical system for filing, and file them in a way that are recognizable. So yes, this is obvious, and if you have a computer-based, some of these issues might not definitely won't be applicable. But if it is a paper-based, then you have to store it in a way that is really in order, basically, that you will be able to go and find it easily, and protect it from obvious things like water, fire, humidity, rodents, insects, to make sure that it stays there for as long as you want it. So we've talked about paper-based. How about laboratory information system, which is a computer-based software? So obviously, the primary objective of lab information system is to improve efficiency by automating the overall lab workflow, data storage, data analysis, and test result reporting system. And that comes with, obviously with a lot of challenge, but we'll discuss about it. And it has its benefits and it has its challenge. And when we try to introduce those laboratory information system, we need to put those challenges as well as the benefits on the table. So what are the things that you need to look into when you think about bringing in laboratory information system? First thing is permanence or continuity, or be able to sustain. It really is not, so I said first thing in addition to, the budget, basically. Budget is obviously the first thing. You should be able to maintain it. You should be able to, back up data. You should be able to have it for a long time, because implementing laboratory information system is not an easy step. And therefore, you have to bring it in knowing that you will use it for a long time to come. The issue of security, obviously, is is something that you need to make sure that what are you able to secure patient information with that software. Functionality, different kinds of functionality includes domain-specific functionality. If for example, does it support blood bank-related workflow, compliance, regulatory compliance functionality, quality management functionality, and others. You have to look into that to make sure you have what you need. System speed, technical flexibility, including configurability, integrability, traceability, and compatibility are also the things that you need to. This obviously is not the entire list, but they're the main. They're basically the main things that you need to look into, or the major things, let's say, to look into when you are thinking to bring in larger information system. So I know that most of you have already a larger information system. And first of all, there are two common larger information system. One is a system that is, a built-in system with the health information system. Basically, it's not primarily designed, or it's not solely designed for lab operations. It is designed as part of the entire health information system. And the other one, which is on the left, is a dedicated larger information system. So for those of you who are already having a larger information system, you may be asked, for example, to consolidate or integrate, use the same LIS module that is that of the HIS. And therefore, what are the things that you need to look into? Those are what points you need to look into. How would you convince otherwise if you think that it's not a good idea to your management or to your leadership? We'll discuss about it. But before that, okay, there is one more slide. So the difference between HIS, for those of you who do not know, the difference between HIS, LIS module and dedicated LIS is that the dedicated LIS is built with the lab in mind, whereas the HIS LIS module is basically built with a patient in mind. It's more of for a clinical purpose. So it may not really cover the clinical and operational needs and expectations of the lab. And there are the things that you need to put in consideration. So, as I said, you may be asked, to move to a HLS-based LIS module. And the things, there are very interesting and also points that make sense when they ask you to go to HIS-based LIS module. One thing is to, one purpose is to consolidate and standardize, which makes sense, right? And it is a single vendor. You don't have to deal as an institute or as a hospital. You don't have to deal with multiple vendors. And they might say significant cost saving and a seamless integration. But the question that we need to ask as your laboratorians is this question: does the LIS meet the current and future operational and clinical need of the organization? And usually, the way to find out this is to look into the details of these two different LIS, diverse and domain-specific functionality. Do they have it? And vendor responsiveness. This is very important. Support is very important for us. And a very high standard support is what we need. And do you get that? And when we say there is significant cost saving, is it real? Are we comparing apple to apples, basically? Are we including the switching cost? And when you say there will be a seamless integration, is it true? And does it include also, if you have, for example, reference labs, would that include that? And if you are a system within the, labs within the system, are we going to have a real seamless integration? Those are the things that we need to put into consideration. So I have a question for those of you who have a laboratory information system. What type of laboratory information system does your laboratory use? And this is another poll. All right. Okay, so dedicated LIS software 55%, and HIS integration LIS module 19%, and 26% do not have LIS. Great, thank you for that information. So those of you, who use dedicated LIS software, if you have, a different EHR that has LIS module, you might face sometime down the road, you might be asked to switch to that, and those are the things that you need to put into information into consideration. So there are different types of softwares, and I'm sure those of you who have already LIS know this because you have been, I'm sure you've gone through this. But for those of you who are, planning to bring in LIS, depending on your needs and budgets, it could be commercial off the shelf, which is ready to go, customized or open source. I'm I'm familiar with the commercial off the shelf, but generally they differ based on fee and support requirements. And I'm a bit curious to see those of you who have LIS software, what kind of LIS software do you have in terms of whether it's open source or ready or custom? Okay, very interesting. So 17% use the COTS, 48% use a custom, 11% use open source. Yeah, very interesting. Thank you. Thank you. This is this was our last poll. Thank you for participating in the poll. Would like to close it, or should I close it? All right, thank you. All right, so what are the benefits of LIS? The advantages are obviously, it will be helpful to error reduction. You will have a better management in QC, be able to easily retrieve data, and you will have a detailed, legible with, formatting, flexibility reports, and be able to track your reports, track and analyze trends. This you'll have an analytics basis benefits, and you will have access control, financial management, and integrate with other sites. So obviously the lab information system software has a lot of advantage, but it's not without challenge as well. So for example, training, timing and money, not timing, the time and money. And especially this is true at a time of transition where, some who are used to, doing the paper-based information management may not buy it, or may have hard time to, transition themselves to a computer-based information system. So it will require may require some time, and also a lot of training and counseling and education at the beginning. So that could be a challenge. As I have, adapting to a new system, yes, as I mentioned it, it won't be an easy transition, obviously, and it will require continuous supervision and training and counseling, especially at the transition period. Cost is, some of the reason is probably why some labs are still on paper-based. It is probably the cost, because some of the cost could be prohibitive, depending on, may differ from lab to lab, but cost is not easy, not only to purchase it, but also to maintain it and to support it, because it's a long-term process. And backup requirements could be a challenge, and especially in an area, if you live in an area where, there is a continuous electricity outage, and those are the things that would be a challenge, and it is something that we need to put in consideration when we think about bringing in a lab information system. So to summarize, lab information system is a system for managing both incoming and outgoing data. So we're not only talking about the results and in between, but also, the information that we get through the requisition form is part of it. And it could be, as we discussed, paper-based or computer-based, and both require similar framework. The principle is the same. And cost is a major factor in using a computer-based system. So a good information management system will ensure all the final product of the lab, which the result is well managed, and consider all the ways laboratory data will be used when planning a system, and assure the accessibility, accuracy, timeliness, and security of data, and ensure confidentiality and privacy of the patient information. And that's the whole point of why we need to manage our information, our patient information. It makes sure it is accurate, accessible, it is confidential, and it remains private. With that, that concludes our session. Before we go to the case, if I have any question, I'm happy to take some.
Thanks, Dr. Mira. We have a couple of questions. I think we can do those. So the first one is from Isaac. What is the best way to validate a computerized lab information system? And can you validate paper-based information systems?
That's a very good question. About the paper-based, can you validate it? I'm not sure. I mean, you can obviously, oversee it. You can obviously supervise it, and the leadership could make sure that the paper-based that are being in the lab are standardized, and the right format and reporting design are being used. Other than that, I can't think any way how we could validate a paper-based information system. Other than making sure that the documentation process is intact and the storage process is intact and the registration is well designed with the intention to generate reports in the future. But the lab information system, so when you introduce it, so I don't know if the question meant when you implement it or when you are using it to, let's say, for example, if you introduce a new test, how do you validate the LIS system? If that is the case, then there are different ways that you can validate whether the LIS system is working or not for a particular test, for example. So if you're, for example, bringing in troponin and you want to make sure that the reporting format is the way you want it, is you could test it. There is a way to test it, whether the units are right. You could test it whether rules are firing. You could test it. So there are ways, a lot of details basically, but there are ways to validate it. I don't know if you want that, but that's what I think.
Great. And then the next question is, this is a really interesting one too. What or how is the best way to back up data for a computer-based LIS?
So the best way to back up data. So it would depend on the server, right? So one way, I mean, if you have, so the LIS itself might have a way, automatic way of backing up the information, right? And that's one thing that you would think about when you vet, the software. And another best way, maybe on a different server, the remote server. I don't know. I'm not really the expert on that, but it's a very interesting question.
Yeah, I think, Mira, the issue you're getting to the point of it is that when someone sells you or recommends an open source LIS, or you have access to an LIS, because of the amount of data that are generated by lab information systems, the system itself should have a way to hold the data, and then it should have a backup. I think typically what people find is that if you have a local storage version where you have, a server or a large device to store information, there should be a cloud-based backup in case that server breaks or is destroyed, et cetera. And that can pose challenges if there are rules or regulations about using cloud-based backups. You can always have a secondary physical backup, like a second server, but it still runs the same risk of, if there's a fire or there's some kind of water damage in the same space. So that physical server has to be in a different place for safety purposes. So I think it's a great question. And I think what the general response would be is that most software now has a cloud-based storage, which means the data is kind of automatically backed up because the cloud is secure.
Exactly, and that's why when you're working on bringing a lab information system, one of the things that we should look at the lab is to make sure that how we back up that system. That's a big question that we need to answer before we bring in the software. Yeah.
Great. Okay. How often should the lab validate the LIS in order to check if instruments are interfacing the results accurately?
Well, I think this would depend on the regulation, or if you're accredited, then it would depend on the accreditor or local regulation. But I do believe that maybe I think twice a year should suffice. Unless a regulation says otherwise.
I would also say anytime there's a firmware update to the instrument or a version update to the LIS software, it would be a good idea to do a small validation. Because sometimes the instrument manufacturers will implement a change and they don't realize that it's going to mess with the integrity of the data interface. But that does happen quite a bit.
Yeah. And if there was any major maintenance procedures that would impact the interface, I would also check that.
Okay, so these two questions are sort of related. So it says, I know one health institution tried to implement computer-based LIS. However, tolerance or intolerance from lab staff occurred. What do you recommend the transfer from paper-based to computer-based concerning data loss problem and continuation? And then a second question is, how is it best to validate computerized systems from paper-based systems when you go from paper to computer-based?
Yeah, so essentially, as I mentioned, when you transition from paper-based to computer-based, you're basically disrupting the status quo, and people are used to, writing it down themselves, and so, they might not be very good into computers, and you would see some sort of resistance, and I think continuous education and highlighting the importance of transitioning to lab information system and continuous supervision in a way to make sure that to make sure or to give support whenever they encounter challenges is one way to go. And what was the second question then?
It was
how would you validate?
It was basically when you're going from if you have a paper-based system and you're going to a computerized system, is there a process to validate that?
Not that I know. Basically, the information system that you're going is built in the lab operation in mind. So essentially, it would be the paper-based system would be most of the time a subset of the lab information system. So everything you need will be included in that system. But again, you'll have to basically make sure. I don't know if there is any organized way of validating that.
Okay, and then I think the last question is, how do you do double data entry in LIS in a busy laboratory?
Well, yeah, so I think we have to understand the spirit of why we do these checks, basically, if that's what the question meant. So yes, we have busy labs, but at the same time, we should equally be interested to make sure that the data that we enter are, accurate. And therefore, so if I understand the question correctly, the double entry would mean to make sure that, you are entering in the right way. And therefore, I think it's important to have those checks.
Okay, thank you so much, Dr. Tesfaji. I think that's all we have for today. So remember, you should be getting the registration for the session on Thursday. Make sure you register for that, and there will be a case to look at beforehand, and then we will see you all on Thursday. Thanks so much for joining us.
There is a case, yeah.
Oh, we haven't done the case yet.
Yeah, we haven't, but it should be very.
Okay, all right, go ahead. Then we'll do the case now. Sorry about that.
Yeah, that's fine. And go ahead and all right, so the case is a summary of what we've talked about, but I'll briefly touch upon. So I'd like to ask you first. So let me read the case for you and then see what you guys think. So you manage a lab for a 300-bed hospital in a low resource setting, and the administrator had just notified you that funds are available for purchase of a computerized lab information system. So the first question is, how do you assess the relevance of such a system for your lab? We've been touching it during the discussion, so see if you remember it. How do you do this? Like, let's.
So since participant mics are not open for this webinar, maybe we could ask if you want input from the audience, they can enter using the chat.
Yeah, or that's fine. Or we can just go ahead and discuss it, and then we ask them if they have any question.
That works as well. Yeah.
Okay, great. Thank you. So the first thing is that how do you assess the relevance of such a system for your lab? Again, it falls into these three pillars. I mean, obviously, the list would be way beyond this. So if you have a paper-based lab, you're going to need it, obviously, and whether you can afford it or not is a question. But if you decide to get one, which in this case you have a fund to purchase it, the question is if this fund extends to also maintain and support the system. That's one of the things that you need to put in consideration. So we can talk about three things. First, establish the need that you need it. So obviously, if you have a paper-based lab, then you need it. And a support mechanism, and the implementation process and continuity, or to sustain it. And this is both in terms of budget and human resource and computers, internet if you need it, consumables, and IT support as well. And commitment is making sure that the institute is committed, if it is just hospital, or at the ministry level, if it is a nationwide project, or if it is, even if it's not a nationwide project, it's important that you get support. So for, that support will help you sustain, the information system. So I would say that you can determine that the relevance based on this. Yeah, first of all, you establish the need, and you know that you have a support mechanism, and you know that the leadership is committed, and you can afford it, not only to purchase but also maintain, and that's how we determine that in a nutshell, basically. And what are the major elements that you need to vet should you decide to implement? They can be categorized into three. And one is finance, obviously, it should be, or budget, you should be able to afford it and maintain it. And second one, which we've discussed it already, is the technical and functionality details according to the current and future operational and clinical needs of the lab. And continuity is issue. How do you maintain it? Do you have the support system? Do you have, can you train them? For how long can the vendors train your, or how often can the vendors train your staff? And those are the things that you need to put into consideration, making sure that you have all the functionalities and technical details that you want for your workflow and for the clinical needs. Any question?
We do have a couple more questions, but not related to the case yet. So maybe we can hold those till the very end.
Okay.
Yeah, we're not getting any questions on the scenario.
Okay, that's fine. So we can go to the other questions if you like.
Okay, so we do have one that says, so if instruments are interfaced with the LAS and the results are sent to the LAS, how can you verify correctness of the results that are being sent in?
Oh yeah, so you have to verify it before you actually use it for a patient. And that's what I say, you know, as part of the validation process, you need to verify first that, you know, the system is working as intended. And there are a lot of details to do that actually. And, you know, basically check the rules, check, you know, the rules, whether it's firing the way it is in a test mode. And there should be a way, I don't know what LIS system you're using, but there should be a way to do that.
Yeah, and I think you'll want to have a standard policy or procedure that
Exactly.
would outline when validations are needed and what level of validation is needed for different you know, for starting use of the system, and then if there's an update.
Very true. So if you have LIS, it's the expectation basically as a lab is to have, like in other you know, procedures that you have for quality for each test, then you are expected also to have a standard procedure for how to validate the very question that you ask, things and others basically for the LIS system. Yeah.
And then, oh, this one is also, should validation of the LIS be done with every system upgrade? And I think I opened that can of worms, so I can give the initial response to it. I think a lot of, it's going to depend on the policies you have in place, but I think generally in the US at least, most of these decisions will be based on kind of a risk assessment. You'd want to talk to the vendor about what's included in that upgrade. Is it a major system upgrade or is it just bug fixes? And I think you'll probably want your policy to reflect, you know, how much of a validation is needed based on the risk of that upgrade. That's probably the best way to do it, because you don't need to do a full validation if it's just, you know, a small bug fix. But if the vendor is changing the database structure, then you probably do want to do a validation. So that's something where you'd want to have a policy in place and talk to the vendor before implementing the upgrade, and also make sure that you have a backup plan in place to, you know, revert back to an old version if there's an issue with the upgrade you're doing. But
So I think that's all of the questions, and we've completed the case, yes?
Yes.
All right, so this time, thanks everybody for joining us. And you will get a registration email for Thursday shortly after this session concludes. And we hope to see you all on Thursday.
All right. Thank you. Thank you, everyone.
Thank you. Bye-bye.